This is Residents in a Room, an official podcast of the American Society of Anesthesiologists, where we go behind the scenes to explore the world from the point of view of anesthesiology residents.
Just to be inspired by the individuals that go there, try to soak up all the information like a sponge.
All of the committee meetings are open, and so you're allowed to attend and observe.
It's a great space to find a long-term mentor and other mentoring connections.
Meeting these inspiring people at this meeting could play a pivotal role in where I land as an anesthesiologist, as a young attending in my career.
Hi, and welcome to Residents in a Room, the podcast for residents by residents. I'm the host of today's episode. My name is Dr. Lauren Paul. I'm a CA2, rising CA3, and chief of the University of Texas San Antonio Department of Anesthesia. Today, we're going to talk about ASA's annual meeting, Anesthesiology 2025, with Dr. Elizabeth Rebello, and one of my fellow residents and a med student. Let's start by meeting our guests.
Hi, everybody. My name's Jackie, or Dr. Ho, but call me Jackie. I'm also one of a rising CA3s with Dr. Paul here at UT Health San Antonio. Very nice to meet everybody.
Hi, everyone. My name is Rebecca Tsai. I'm a third-year medical student at Rebello College and currently completing a research year with the fair at the University of Michigan. I'm also the medical student component president, and I'm really excited to be here.
Hi, everyone. My name is Elizabeth Rebello. I'm a professor of anesthesiology and perioperative medicine at UT MD Anderson Cancer Center in Houston. I also serve as the meeting chair for the 2025 ASA annual meeting in San Antonio. And I actually trained, I went to medical school and residency in San Antonio. I'm really excited about the meeting this year in San Antonio.
So let's start out with some questions. I'm going to ask the first question, and it's actually a very interesting one. So why should medical students and residents go to ASA? It sometimes seems like it's a thing to do once our career is further along, but do you think there are benefits to going earlier?
Absolutely. I think there's tremendous value in attending the ASA meeting early in your training. It's not just a conference, it's really where the future of our specialty is shaped. And attending as a medical student or a resident really gives you early exposure to some of the cutting edge science. You get to meet mentors and really understand a sense of the broader community and specialty that you're joining. The sooner you engage, the more intentional and informed and satisfying your career can be.
That's great. You know, for those of us who have been, sometimes you can attend virtually, or other years we attend in person. And I'd like to know, what's the benefit of being an ASA in person rather than opting for the online version?
Great question, Dr. Ho. And, it's interesting because there's so many things that we can do virtually that are effective. But really, in terms of the ASA annual meeting, there's no substitute for being present in person. The in-person experience allows for spontaneous conversations that you would not have otherwise, face-to-face interaction with leaders of the society, and you're able to form connections that can't be replicated online. You're not just consuming content, you're participating, your input is really valued, and the experience of meeting thousands of peers, mentors, and future collaborators is really unsurpassable.
I completely agree with you, Dr. Rebello. And what do you think would surprise our medical students?
I think from what I've heard, from the medical students I've interacted with after they've attended a meeting, is they're impressed at how approachable the leaders in the field are. You walk into a panel discussion and you're realizing you're sitting next to a president-elect of the society or a committee chair or someone whose paper you just read. And you realize that, wow, you get to talk to them. You get to hear about what they're doing. They're excited to hear your perspective because they realize that medical students and residents are the future of our specialty. And it's a reminder that really at any stage in your career, our specialty really thrives on both curiosity and collaboration.
I couldn't agree more. I remember the first time when I went back in 2023, the excitement, the buzz, it really felt like Disney World for anesthesiologists. And I just remember the genuineness. Everyone was willing to engage and make new connections. It's a great space to find a long-term mentor and other mentoring connections. How about the other residents? What do you remember during your first time and what surprised you?
The first time I went to ASA was when I was a med student in 2019, and that was in Orlando. And I remember feeling the same way. It's kind of funny you said the Disneyland comment because it literally was in Orlando. So it did feel like that for me. And I remember there being so much free swag, all these overwhelming, amazing things to check out from, all of the different like glide scopes and all of the different fun things they have for anesthesiologists to play with was really fun. But also a lot of us presented a few posters. So that was a great experience for us, just from a research perspective, to get our voice heard and critiqued. And also one really good thing was the meeting that they had with the residents and program directors. And I believe that sold out really, really early. And every medical student was trying to get into network. So that was a great networking opportunity for us.
One thing that I've enjoyed seeing is the medical students and residents interact with faculty and go to a school, usually a middle school, and talk about their experience into medicine. It's such a joy to see, middle school students connect with medical students, resident, and faculty. And really, at any stage, you're able to share your experiences and people are able to kind of draw from that, and it resonates with folks. And I just really enjoy seeing that aspect of it as well. And it's fun to, ride on the shuttle bus and, interact with the students in that capacity.
That's so fun.
I can kind of speak to the resident side of going to ASA. I had never actually been to an ASA meeting until I was a resident. And I went last year for the first time as a CA1 when it was in Philadelphia. And, I went originally to present some medically challenging cases, and I ended up leaving with so much more than just a presentation, but, getting to network with program directors and faculty from all over the country, and to be able to network with other residents from other programs. It's really a unique opportunity to be in a place with so many people that have the shared common interest of anesthesiology. I think that there's just so much to learn from that. And it's a great way to be able to not only network, but learn more about your specialty. And there's a great buzz around the meeting. It's really exciting. So tell us about ASA's early career membership program. I hear that it includes one free registration to an annual meeting, which is always, a great perk.
Yes, absolutely. So the early career membership program was started a few years ago, and it's a great resource designed for anesthesiologists in their first 3 years of practice. And it includes a 3-year membership, a curated educational package, plus a free registration to the annual meeting. And so one of the big benefits of this is that you're able to interact in person. If you're interested in being on a committee, you can actually apply and be on one as a resident. But as an early career person, I think especially that input is so valued by the committees. It's a great way to be a part of the society and such.
Dr. Rebello, as anyone who's been to one of these meetings, it's so overwhelming and there's multi-level things to do. It's over a couple of different days. Do you have any tips for us to how to navigate the meeting to get the most out of it?
Absolutely. First, plan ahead. And I would say find out from your institution who's attending, because it's always great to interact with those people that you work with outside of work, and the meeting provides that opportunity. The ASA app is another great resource. It's very easy to look through the app, flag the sessions that align with your interests, leave some time for exploring the city, and then please don't skip out on the networking events. There are some of the best interactions occur there where you actually meet and interact with people that you've never met before that have common interests. Many of the important conversations actually happen at these networking events. And then don't be shy. Introduce yourself. Ask questions. You belong here, and your presence is more than welcomed.
And one quick tip for medical students, especially those coming for the first time, we have a medical student meet and greet on Friday evening, and we would love to meet you there. There's going to be so many people excited to meet each other. And another tip I would say would be not to feel pressure to go to everything. You will feel very overwhelmed on your first day. And so if you feel a little tired, it's okay to take a break as well. Dr. Rebello, what about you? What are your can't miss lectures?
So I think the can't miss event for me is the keynote speaker. This year's speaker is Dr. Lucy Kalanithi. Her husband, Dr. Paul Kalanithi, wrote the New York Times bestseller, When Breath Becomes Air. And I think just hearing about human suffering from being not only like a patient or a patient's caregiver, we see it from the medical side, but this also provides another side. And it's a great, great story. And she I think has a lot of wisdom to share with us. So I really enjoyed both the opening ceremony and then the exhibits. There's so much energy at the exhibits. You get to learn and see so many interesting things in terms of both the equipment, the demonstrations. We have the dog bark break. Last year, one vendor actually was handing out Narcan in light of the opioid crisis, and it really shows us that in anesthesia, we can touch so many people's lives. And both being at the opening ceremony, being at the exhibits, being the opening celebration, you get to really see that and take some of that home with you and impart that, on those that you interact with, both whether it's your patients, your colleagues, or your family and friends.
I completely agree with you, Dr. Rebello. I remember last year being at the meeting and staying in the exhibit hall for probably 3 to 4 hours with my co-residents, just wandering around. They were giving out McGraths. Dr. Wolpaw was actually recording a live episode of ACRAC in the hall. So it was really exciting to get to see all the things that we use in the ORs actually in this huge auditorium, and people talking, teaching about it, and giving out free samples. It was really a neat opportunity. And of course, the puppies. There was a vendor that had puppies that you could play with, and so that was very fun. Moving on to the next question. So what's in it for those of us who want to get more involved in ASA?
So ASA really offers so many pathways in terms of what your interest is. If it's advocacy, education, wellness, management, patient safety, I would say, be sure to get involved. Attending the meetings, all of the committee meetings are open. And so you're allowed to attend and observe. And it's actually a great time of year because it's October, and then the submissions for self-nomination for the committee is January. So it gives you time to think about if you want to be on a committee, prepare a nomination and such, and really get involved. I really believe getting involved in the ASA really sets you up for your career for the next 30 years. And the earlier you get involved, the better. I was actually a second-year resident, when I attended my first ASA meeting. It was in Las Vegas many, many years ago. And really think that's what sparked it for me in terms of getting involved. I really have no regrets, and really am amazed at all the interesting people I've met and experiences I've had from attending the ASA meeting year after year after year.
I totally agree, Dr. Rebello. I think that's one huge thing for residents and medical students is the network opportunities. You're going to run into people that you know. You're going to meet amazing new individuals who are all incredibly friendly, as everybody is in the field of anesthesiology. And maybe you'll find a job. Maybe you'll find some lifelong friends. And it's really an exciting time. As someone who's lived in San Antonio for multiple years, I think you attended medical school and you did residency here. I really want to know what you're most excited for with the conference being in San Antonio this year.
Thanks for that question. I love all of the unique experiences that San Antonio offers. The Riverwalk is very walkable. There is excellent food from Texas barbecue and Tex-Mex food, great margaritas, great music, great culture. Market Square, you feel like you're transported to a different part of the world. There's so many just unique aspects of the city. If you're into history, there's the Alamo, which is a UNESCO World Heritage Site. There's so much San Antonio has to offer that I'm just surprised that the ASA meeting's never been in San Antonio before. So I'm really excited that it's here this year, and I can't wait to see you all at the meeting in San Antonio.
Yeah, we're so excited to meet you. And I do feel like San Antonio is an underrated city. We're all excited to have just the hustle and bustle of ASA here. It's something that we've been looking forward to for as soon as it was announced that it was going to be here.
Great. Thank you. Now, I have a question for you all. Some of you shared what you've gotten out of the meeting, but I'd like to hear if you were giving advice to your peer who is a first-time attendee, what would your recommendations be from your perspective? I'd love to hear from all three of you.
I'll go first. So as somebody who never went to a meeting as a medical student and went for the first time as a resident, as someone mentioned earlier, it can be a little bit overwhelming. You get there and you have this long list of things you want to be able to make it to. And I would say just don't overwhelm yourself with the amount that's out there, and just try to make it to everything that you can make it to, and put yourself out there. Don't be afraid to introduce yourself to people and to be friendly to people, because like Jackie said, you never know who you're sitting next to. You never know who you might meet. And the networking opportunities are just amazing at this meeting. So don't be afraid to be bold and introduce yourself to those around you and try to make friends, because you never know what those connections might mean for you in the long term.
I'm going to echo Dr. Paul with that. I think as a medical student and even as a resident when I went last year, I was a little nervous to go. Maybe I'm going to meet some new people, or it's going to feel like an audition, but that's totally not the case. I think a lot of people attending, medical students, residents alike, are going out of a passion and out of a love for anesthesia, and everyone is there with a great attitude. So it's not like you're auditioning for anything. Everyone's there to have a good experience. So that's one thing if you're nervous, to kind of calm your nerves. But things that I would recommend doing is going to these panels. I didn't think that they were over my head as a CA1. I thought they were very easy to digest. I remember going to one that was understanding TEE for the general anesthesiologist, and that was incredibly helpful, and they made it really easy to digest. And like Dr. Paul said earlier, seeing that live from the center stage for the ACRAC podcast with Dr. Wolpaul, Dr. Akuch, that was so fun. Just taking that in and seeing them record a podcast live was super fun. I remember even getting headshots, and we used that today. There's so many things to look for, and it's a really fun experience, and there's so much to get out of it.
I also would echo everything that you both have shared. It's just such an exciting place to be. I would say, in addition, to check out our Medical Student House of Delegates session. This year, we will be having Dr. Eric Riley give the keynote talk. He is the past resident component president, and he'll be speaking on why advocacy matters and how it shapes our profession as future anesthesiologists. So super relevant and honestly very, very inspiring. Also, the medical students will have a subspecialty open house, which residents, you're welcome to join us as well. I believe it's a joint session, but it'll be a great way to explore different areas of anesthesia and talk to the experts. And we'll also have sessions on the residency application process, especially if you're in the thick of it with the ERAS season having opened up. And then new this year, we will have our special medical student-specific problem-based learning discussions, PBLDs, which we've never had before. And so it's just a fantastic way to dive into real-world cases with peers led by faculty.
That sounds fantastic. And I love that each year the meeting evolves based on how people learn. And so two of the sessions that are new this year are the fireside chats. And we have those not only with the opening session, but for each of the tracks where the experts are up there and anybody can ask questions and interact with those that lead that particular area of the field. In addition, there's the Connect, Learn, Continue series, which are small group setting around a certain topic. And the thought is that rather than waiting till the following year to interact, there'll be sessions virtually throughout the year to do that as well. Because the thought process is people really enjoy discussion. You know, we're learning in different ways, and the anesthesiology meeting is adapting to how we continue to learn and develop. So my first experience attending the ASA meeting was actually as a CA2. And I never recognized at the time how attending that meeting really shaped my career over the following almost 25 years. Since getting involved with the ASA, I started by presenting posters and then eventually got on committees and participated in that and led committees, got involved in the mentoring program, really had a passion for the professional issues track and ended up chairing that particular committee, and then got involved in planning the annual meeting, which is about a 5-year commitment. But during that time, I've gotten to meet so many interesting people, have so many unique experience, develop my skill set, bring a lot of that learning back home to my home institution. And it's really helped catapult me learn in a way that I never thought I had before. And I really feel that those that are involved in their national societies have decreased issues with burnout increase career satisfaction and really overall develop a career versus a job. We're so lucky in anesthesiology in terms of, what we get to do and being able to take care of patients during the most critical aspects of their life. And I realized interacting with colleagues and sharing some of those experiences are some of the most memorable experiences that I've had. And so I'd love to hear from you all. I know you're very early in your careers, but love to hear how attending a meeting has changed you and where you think continuing to attend the ASA meeting will shape your career in the future.
Yeah, I think Dr. Rebello, you couldn't be more right. A lot of what you shared, your path to be deeply resonates with mine. So my first ASA meeting, again, was in 2023. Medical students rarely have the opportunity to get to an ASA meeting, really because of the cost. And sometimes your institution has different rules about when you can attend or not. And so I had the opportunity to go to present my MSARF summer research in San Francisco. And I took that opportunity to take a look into the other events and items planned for medical students specifically. And so I found out about the House of Delegates meeting, that there was an opportunity to become a delegate of your medical school, to represent your school at the HOD. And so I did that. And then I found out after that there were elections for the medical student component. And I took a look into the various positions that were open and decided that, wow, I think I would really love to make a difference as a president. And so, thought more about it, thought about what I wanted to bring to the table and the things that I would want to accomplish through that role. And, when it came time in October, I presented my research, and then I ran over to the HOD meeting and gave my speech to become president. And that was 2 years ago. And I would have never had this opportunity now to make a difference within medical education at the national level, advocacy to promote research, to really bring my fellow medical student peers along in creating these opportunities if it weren't for that one sponsored trip as a second-year medical student to San Francisco. And so I'm really grateful to the fair, to my MSARF mentors who helped me get there. And, I wouldn't have met you as well, Dr. Rebello, because of going to the biannual board of directors meeting. That's where we met. And so, again, just extremely grateful to be surrounded by like-minded mentors and have amazing synergy.
I think Rebecca brings up a really great point that mentorship is huge, and surrounding yourself by people who are dedicated advocates to the field of anesthesiology is one important thing in each of our careers, which you'll find multitudes of those people at these conferences. To answer the question is, how is this going to shape the rest of our career? My hope every time I go to one of these meetings is to become a stronger advocate for our specialty ultimately. I'm there to, one, strengthen my own learning opportunities by attending these panels and presenting research and getting good feedback, but also just to be inspired by the individuals that go there, try to soak up all the information like a sponge, because unlike Rebecca, I wasn't necessarily the president of any ASA committee or even in the House of Delegates. And I felt like I was just a normal medical student who wanted to learn about the field of anesthesiology, but it was really inspiring, and it's making me want to shape my practice in a certain way that potentiates the field of anesthesiology. I want to be a great physician, and I want to be a great advocate for patients, but I also want to be someone who is going to be beneficial to this practice and help potentiate it within the future. So this is a great way to figure out how to do that, how in any way, shape, or form you can get involved and really commit to a lifelong learning opportunity.
I completely agree. To echo Jackie, I think that the people make this specialty. And I think that the people that are in anesthesia are, a huge part of what we do every day. We are the last people that patients see before, the scariest moment of their lives when they go to sleep and undergo surgery. And their very worst day is where you were meeting them, essentially. And so the people make the specialty. And I think it's really cool that all three of us, Rebecca's a medical student, Jackie is applying for cardiothoracic fellowship, and I am trying to decide what I'm going to do with my career. So we're all coming from very different backgrounds and very different paths in our futures. And, I think that for me, how it's going to shape my future career as an anesthesiologist, I'm still undecided whether or not I want to pursue a career in academics or whether or not I want to pursue a career in private practice. And so I think that meeting these inspiring people at this meeting could play a pivotal role in where I land as an anesthesiologist, as a young attending in my career. So I'm very excited to see this year who I get to meet in my own backyard. I'm excited that the meeting's in San Antonio, and I'm just excited for the buzz around the meeting. I think this is a great place to host the meeting. We have so many great things to do and see here, and I'm excited for all that is to come.
There's so many paths to take as an anesthesiologist. And one thing that's really surprised me over the years is, years ago when I was a medical student, anesthesia was really confined to the operating room. And now with the neural locations and with so much of medical care being involved around procedures, anesthesiologists are in the interventional radiology suites and doing GI and cardiopulmonary and such. And so it really helps us, as anesthesiologists, have a perspective of how healthcare is overall. And actually, anesthesiologists make great leaders because we understand so many different nuanced areas of the health system. And so I think that anesthesiology has such a bright future, and there was no place to get the most current information than at the ASA 2025 annual meeting this year.
Well, thank you so much for sharing your expertise, Dr. Rebello. And thanks again to my fellow co-chief and to Rebecca, our medical student leader, for such a great conversation. This was such a great way to end this discussion. And to our listeners, we hope you'll join us again for more Residents in a Room, the podcast for residents by residents.
Leverage peer-reviewed resources and an engaged community to further your knowledge and skills. Get answers to your questions, tap into the latest coursework, and learn delivery technologies developed by programs around the world. And see how you're progressing relative to your peers. Tell your director or coordinator to sign up your program for ASA's Anesthesia Toolbox. Visit asahq.org/toolbox for more information. Join us for Residents in a Room, where we'll share timely info, advice, and resources designed to help residents succeed in residency and beyond. Find us wherever you get your podcasts or visit asahq.org/podcasts for more.